If you like what you see in the video, please leave a like and subscribe. It really helps me out, and maybe check out my Patreon and social media in the description. So one of the huge side effects of the coronavirus pandemic is that it's basically shown the world in various different ways that there's plenty of money to spend on stuff society needs. It's all about the will and if people want to spend it. So it's kind of putting a massive dent into right-wing and libertarian arguments about the economy and about money, because it seems that money is not an issue and we can literally just pull it out of thin air to spend as much as we want. Now, these sorts of economic measures are being done in the West by centrist and right-wing governments, especially in the UK and the US. So again, when they talk about being fiscally responsible and cutting social policies and cutting things like the NHS, or in America, Medicare and Medicaid, it's frankly just because of their greed, and what they want to spend the money on is enriching themselves, or policies that will eventually lead to their enrichment. But this hasn't stopped a growing number of libertarian, like maybe conservative figures, talking about a form of eugenics to help save the economy. Namely that, is it really worth spending all this money to save people? Is it really worth spending all this money to save the elderly and people with pre-existing conditions? Obviously it's a pretty sick argument. In a world where money seems to mean nothing anymore, are we really going to argue and throw around how much money life is worth? You know, is a life worth £200,000, £500,000, 1 million, 1 billion? And these are also the types of people on the right who froth at the mouth about abortion, but now we're playing a game over how much someone's life is worth. I thought life was priceless. But let's get into the article he wrote for something called The Critic. I'm going to read a fair bit of it because I just want everyone to get a sense of what he's talking about. You'll probably be pretty shocked. I'll highlight the bits that I think are the worst, but you guys can make your own mind up, of course. And before we get started, I should say that he wants schools to open in 2 weeks in the UK. I don't know how insane you have to be to think that, since it's only going to get worse here. Has the government overreacted to the coronavirus crisis? Toby Young questions whether the drastic measures put in place now will harm us more in the future. And he writes, like a growing number of people, I'm beginning to suspect the government has overreacted to the coronavirus crisis. I'm not talking about the cost of our liberty, although that's worrying, but the economic cost. Even if we accept the statistical modelling of Dr. Neil Ferguson's team at Imperial College, spending $350 billion to prolong the lives of a few 100,000 mostly elderly people is an irresponsible use of the taxpayers' money. So we're going to see where this article is going. That may sound cold-hearted, yeah it is, but this isn't a straightforward trade-off between public health and economic health. People are killed by economic downturns just as surely as they are by pandemics, and more years of life will be lost than saved if the lockdown is prolonged. The government should end it as soon as possible and encourage people to return to work, limiting social distance measures to the elderly and those with underlying health conditions. Now, just start on that paragraph. It's dangerous anyway, even if it did specifically affect the elderly. There's just a story today in the UK where a 13-year-old boy died from it. So it's not just the elderly. You're going to cost hundreds of thousands, potentially, lives of people who aren't elderly. And I don't know why you see the elderly as disposable anyway. Also, I find it funny that he's talking about people being killed by economic downturns when Tories and Conservatives consistently create these downturns and create an economic policy known as austerity, which the UN says actually kills people. So don't believe them when they say they care about the economy killing people, because they design the economy to kill people. Especially when you have nutcases like this who are saying a few 100,000 lives are not worth £350 billion. Hundreds of thousands of lives are not worth £350 billion. So he continues, let's begin by assuming Imperial College's numbers are correct. On March 16th, Dr. Ferguson's team predicted there would be 500,000 fatalities if the government did nothing, 250,000 if it continued with its mitigation strategy, and 20,000 if it switched to suppression. In other words, 230,000 lives would be saved if the government locked down everyone. That seems good. These are the numbers that persuaded Boris Johnson and the cabinet to switch tack. That's good then, because they were pursuing herd immunity, which is bollocks, and that could have caused 500,000 deaths. So it's better what they're doing, halving that number. So at its simplest, the government has valued each life at £1,500,000, and that is his number when he divides 350 billion by 230,000. Now that's almost certainly over egging it. The Imperial College team estimated 250,000 would die if everyone who required medical treatment received it, which they wouldn't because the NHS lacks the capacity to treat that many people, not helped by Conservatives consistently cutting the NHS. In addition, there wouldn't be zero economic cost of mitigation, which involves home quarantining of suspected cases and those living in the same households, and social distancing of the elderly and others most at risk. Rishi Sunak, who's a Chancellor in the UK, would need to take some measures to offset those costs as well. Finally, the $350 billion the Chancellor's committed to bailing out the economy isn't a complete write-off. $330 billion of it takes the form of government-backed loans, and some of those will be repaid. So let's just adjust the denominator upwards to say 370,000 and the numerator downwards to say 185 billion. That yields a cost per life of 500,000. That's good. That's like the same salary as a CEO in this country. So one CEO's salary for a year can save a life. I think that's pretty good. Is that high? That depends on how many years of life you're adding to the people saved. How many quality adjusted years of life will the government be adding to those people whose lives would otherwise be lost to coronavirus if the lockdown hadn't been imposed? For it to be worth spending 500,000 per life, the answer would have to be about 16.5 according to the NICE's evaluation criteria. So NICE is the body that regulates drug prices in the UK, and they won't regulate a drug and approve it in the UK if it doesn't offer a significant benefit to people and improve on their years of life. But I don't think it's really fitting to use this scale in this context, but he seems to think it is. So about 16.5 years, and that seems optimistic given that the average age of those who've died from the virus is 79.5, and average UK life expectancy is just short of 81. This suggests that the lockdown is extending the lives of 370,000 people by an average of less than 1.5 years. Remember, 79.5 is the average age of those patients the NHS is unable to save in the current circumstances. The independent researcher Noah Cole has calculated that the average number of life years added to each of the people who would have died if we continued the mitigation is 11. But if we assume those 11 years are of perfect health, not the case since the majority of people who die of COVID-19 have underlying health conditions, we're still overvaluing those lives since NICE would price those 11 years at 330,000, not 500,000. So everyone, Toby Young thinks that if your life was worth 330,000, that's okay, but you should die if it's worth 500,000. So your life is essentially worth to him £130,000. Again, lots of people make that salary in a year. Lots of businessmen, lots of bankers. So their yearly salary is not worth a life, really. Not worth extending the lives of elderly people a couple years, maybe 11 years, maybe 16 years. You should just save the money. So then he goes on to write insane rubbish about reopening the schools and going back to normal while isolating the elderly and vulnerable. That's not going to work, like I said, because young people and people who don't have underlying health conditions are dying from this virus. But I love how he ends it. It's so funny and so ridiculous as well, and shows you what Conservatives are all about. So good old Toby ends it by saying, some people reading this will think, I bet he changes his tune if he gets the virus. In fact, I've got the virus. I became symptomatic 7 days ago and I've been bedridden ever since, and I'm now anxiously waiting to see if the disease spreads to my lungs. I'm 56 with no underlying health condition, so my odds are good. But if the government follows my advice and it turns out by the time I require urgent care the NHS cannot accommodate me, I won't regret writing this. Yes, I probably have at least 20 years of healthy living ahead of me, so my life worth is more than £500,000. But I'll be the exception. In the unlikely event of the NHS being overwhelmed, the majority of people whose lives could have been saved only have 1 or 2 more years left, and those will not be good years. It isn't worth spending $150 billion to save them. Nor is it worth a 15% drop in GDP. No, everyone, it's not worth a 15% drop in GDP. My death would be acceptable collateral damage. So here is another insane Conservative basically offering himself up on the altar of the market, the insatiable god, the market, who just doesn't value human life, just wants to be fed with the economy. Now, GDP is not even a good measure of the economy anymore. Better measures are taken in quality of life, everything like that, not gross domestic product. It's an outdated form. Now, you know, his life, according to him, the guy who thinks we should accept the deaths of hundreds of thousands of elderly and people with disabilities and pre-existing conditions, we should accept those deaths. But the guy who thinks that, his life is worth more than £500,000, so we should really, really save this guy. Now, if I had 2 hospital beds and you were on life support next to my 90-year-old grandma, I know whose life I would feel is more valuable. I don't think I'd want to save the guy who thinks the one in the other bed should die and everyone like them should die. See, it's funny. I would take him a bit more seriously, even though it's a delusional argument, if he said, yeah, my life isn't worth as much and you know, I'll sacrifice myself to the market like all these other great conservatives. But again, what we've seen, that's what I want to draw it back to, what we've seen in the last couple of weeks is that money, that money does not mean anything anymore. And money is basically a social agreement between what this paper has a value of. So £10, I guess someone £10, that is just a signature, that is just a statement that he has that money. It doesn't exist. Now, I'm not saying like some people, economics, it doesn't exist and it's garbage, because it's not. But money essentially doesn't matter, especially at a time like this. If England was the only country going through it, you can make that argument a bit more, because it's a global pandemic. All these countries are taking measures like this. All these countries are taking loads of financial, I guess, risks and spending so much money. But when everyone is doing that, it's not like the Weimar Republic in the 20s and 30s, you know, printing loads and loads of money, so you have to have wheelbarrows of money because it's not worth anything. It's not like that, because it's a global problem and everyone is doing these things. So for people like me, it's like, you can't place a price on life, but his price for life is so cheap, using this nice scale which they use for drugs. They're using it to invest in new drugs for potential treatments and stuff. And the thing with NICE is that if they reject a new drug saying you don't offer enough improvement to this person's lives, or you don't add enough onto their life for us to consider approving this drug, 9 times out of 10, there is actually another drug the person can take. If you're using a scale for a person with coronavirus, there isn't anything else you can do. You're literally just like, based on this estimate, we should just kill them. That's not what NICE does. NICE doesn't normally look at a drug and say, there's literally no other drug to treat this disease, and we're gonna say no. That's not what they do. And I'm a guy who is a pharmaceutical journalist, so I'll tell you all about NICE if you want. So it's a garbage scale to use. But even if we took it into consideration, let's say it's a legit scale, again, how cheaply does he value life? He says that if you know, your life is worth a certain few hundred thousands, then you should die. But if you're like him and it should be worth over 500,000 because you have 20 years left, you should live. Again, these conservatives and libertarians play really into fascist ideology, and that's why there's the phrase, if you scratch a libertarian, you scratch a liberal, you scratch a conservative, a fascist bleeds. Because what did the Nazis do? What do people like this do? They're like, disabled people, they do not have a value to the economy, they're a leech on society, so let's kill them all. Kill everyone with Down syndrome, kill everyone with physical disabilities, make sure we purge them from the gene pool, because we see everyone as just a cog in a capitalist machine. We see you as a way to make money. There is no value in human life apart from your ability to make money. And it's a sick ideology, and this guy is sick in the head for saying this stuff. But he would probably say, if you said that to him, so we should just kill disabled people then to make the economy better, should we just do that? And there's that funny sketch, Mitchell on Web, maybe I'll play it now, about killing the poor. They're like, how would the economy work if we just kill all the poor?
Have you tried kill all the poor?
Sir, with respect, we've had this conversation before.
I'm just saying, have you tried it?
No, of course we haven't tried it. We're not going to try it.
I'm not saying do it. I'm just saying run it through the computer, see if it would work.
Whether it would work is not the issue.
So you think it might work? That's pretty right-wing.
And I just love how conservatives are showing their true colours. It used to be all about, you know, fiscal responsibility, and there's not enough money for this stuff. You know, we'd love to do all these social programmes, but there's not enough money. But now we see there is enough money, so their response is all this crap, that these lives aren't actually worth this money, rather than there's not the money. You're not worth a couple £100,000. You probably made more than that in your life, but you're not worth it. When you get to 79, 78, you know, if you're a man, your life expectancy is basically done, so yeah, whatever. And the thing is as well, life expectancy and everything is getting older. People are going to be living longer, so it's completely the wrong time to make this argument. But again, these are the same people who are against abortion. They're the same people who say they're pro-life, but only up until a certain point, only if your life is worth more than £500,000. And that's what people like this are saying, especially when we're seeing how much we rely on the people they demonise so much. Nurses, janitors, sanitation workers, people who work in supermarkets, literally carrying on the economy right now. These are the people that they demonise. And what should the elderly get for working their whole lives and paying taxes? You should die from a pandemic. We're just too scared to spend money that has no value anymore to save your life, because what about the economy? What about GDP? Which no one gives a fuck about. It doesn't affect anyone's lives. In America, they're using the same argument about the stock market. We must let people die to appease the stock market. Newsflash, most Americans, most people in the world do not give a shit about the stock market because it's not reflective of how well the economy's doing, and most people don't own stocks. Anyway, let me know what you guys think of these insane arguments coming out of the conservative camp and libertarian camps at the moment. It's genuinely crazy, and you can see how these guys can transition into full-blown fascists with this sort of economic arguments. Anyway, if you like this content, please leave a like, maybe subscribe. Follow me on social media at The Tabernacle. On Twitter is the main one, but also Facebook and Instagram. Please check out my Reddit. That is probably what I'm most active on. So my subreddit is r/The Tabernacle. My personal Reddit is u/Tommy Cahill 1995. Also check out my Patreon and WordPress in the description. And if you made it this far, thank you for watching.